OD'd. We're calling the police.
Ohio finds itself right now in the midst of one of the greatest drug epidemics in history.
Every 2.5 hours, someone in Ohio dies of a drug overdose.
We're seeing younger people dying in their 20s.
My last count, there were over 400 drug overdose deaths here in Franklin County in the last year and a half.
Ohio leads the nation in drug overdose deaths, more than 3,000 a year. Tens of thousands more are addicted. Families are crumbling.
911, immediately, child's down and mother is overdosed.
I just wanted to fix her because I could always fix anything with my kids. And I couldn't fix this.
She called me one day hysterical. They took my daddy. Who took your daddy? The police. I was like, what? Calmed her down. I could hear this one screaming in the background and a lot of commotion. Well, the cops were there and they had evidently taken my son and the girlfriend. They had arrested them for fighting. And they were fighting over drugs.
Grandparents raising grandchildren, medics and police rushing to administer Narcan, police and deputies dealing with a crisis.
She was upset and decided that she wanted to try it just to see what was so important about that narcotic that kept him from his family. Next thing you know, she became an addict.
Prescription opiates are often the gateway to heroin, as 3/4 of the drug overdose victims had previously been prescribed a controlled substance. By keeping these pills away, we can help the next generation.
Ohio leaders looking for solutions. Ohio families searching for answers. Tonight, we'll talk to the experts and we'll tell you where to find help.
We'll take your questions and we will hear from those who have gone through addiction and survived.
To know that you can come from the trenches, see the stuff that I've seen, and know that you're doing the right thing today.
Good evening and welcome to the NBC4 Town Hall, Confronting the Drug Issue. I'm Mike Jackson.
I'm Colleen Marshall, and we are coming to you tonight from Hamilton Township High School, not because this high school is a hotbed of drug activity. We could be in any school, in any neighborhood, in any community, any city throughout the state of Ohio, and we would be in the midst of the drug crisis.
From opiates to heroin to drugs is having a devastating impact on many families across our state and also in our economy. Tonight, we're ready to take your questions and a special call for. We also have an audience filled with concerned people and also an ensemble of great experts to talk about addiction. And let's meet our panel right now. Bill Morrison is the superintendent here at the Hamilton Local School District. He's been an educator for more than 30 years. At one time, he taught special education and technology and was also a coach. He has spent his entire career working with young people.
Dr. Teresa Long is the Columbus Health Commissioner, overseeing more than 40 public health programs, 500 employees, and a budget of more than $50 million. She helped launch SafePoint in 2015. It's a comprehensive partnership with Equitas Health to address heroin and opiate use.
Andrea Boxell is the Deputy Director of the Governor's Opiate Action Team at the Ohio Department of Mental Health and Addiction Services. She helps in writing policy and interprets federal and state laws and regulations, dealing with the opiate epidemic.
And Heidi Riggs knows the drug crisis from the worst possible way. She lost her daughter Marin to a heroin overdose in 2012. 2 weeks after her 20th birthday. And now she uses her painful experience as a wake-up call for other Ohio families.
And Brandy Morris-Hafner is the day reporting administrator for the Ross County Sheriff's Office. Brandy earned 2 college degrees after spending more than 8 years in jail and more than 8 years of addiction. She's been clean and sober for more than 8 years. Brandy describes herself as a recovering addict. Thank you all for joining us tonight.
And we also have in our audience Joe Mazzola, the Franklin County Health Commissioner, Teresa Seagraves, Franklin County Health Systems and Planning Director.
Also Brenda Stewart, she is the founder of the Addicts Parents United. It's an Ohio-based national support group for the parents and family members that have a child or a loved one with the disease of addiction or has lost a child to substance use disorder.
And Upper Arlington Superintendent Paul Imhoff and school board member Stacy Royer also concerned about the drug crisis in Ohio, and they are joining us in the audience tonight, along with a lot of parents.
We also have first responders in our audience tonight who unfortunately, from Hamilton Township, the front row of the addiction problem in our country. Now, while our panelists will be taking your questions from members of the audience tonight, we also have available to answer your questions for our viewers. In fact, our call for lines are staffed by members of the Breaking Point Recovery Center at call for lines that is 614-821-4444. They can address your questions.
Also tonight on our Facebook page, Ellie Merritt and Mark Taylor are hosting a conversation. They're with experts from the Ohio Department of Mental Health and Addiction Services. So we have a lot of people who are available to answer your questions. Some of them know this crisis from the inside. Some of them have been involved in treatment for decades.
Let's begin our questions tonight with Dr. Teresa Long. And Dr. Long, from the medical profession, what have you seen and what has the change been when it comes to addicted people?
So we are experiencing something that we haven't really experienced recently. We've had other outbreaks, epidemics, crises over time. I can tell you, people ask me to put this in perspective compared to more recent public health crises. So compared to homicide, for Columbus, we see twice as many people dying from opiate overdoses as we do homicides. It's 2 to 3 times the number of HIV deaths that we had at our greatest point of having HIV and AIDS cause mortality or people to die in our community back in the early 90s. And infant mortality that so many of us have been thinking about, an infant dying before its first birthday. We are seeing double that number of persons die every year here in Columbus and Franklin County than our infant deaths. So that's one perspective. Let me also share, and I'm glad our emergency medical services and perhaps some of our health systems are here. We are also seeing a big jump in what we've seen over the last 6 months. So I can tell you that from, September or so, we saw a big increase. We now are seeing our emergency medical service colleagues are delivering they had been using 7 doses a day of naloxone or 7 administrations. They're now up to 12 on average a day. We know that our hospital emergency departments are seeing double the numbers of patients that they had seen just less than a year ago. And our coroner, very sobering, our Franklin County coroner, Dr. Ortiz, is reporting rather than 1 death per day right here in Columbus and Franklin County, we're up to an average of 1.7. So that is a pretty dramatic change. So we know that we have a problem. We know we share that, as was stated earlier, with many across our state. But indeed, we're very concerned.
When did you first send up the flag and realize that this is not an isolated problem?
That's a good question. When do we date that? I mean, honestly, Ms. Riggs could tell us that back in 2012, 2010, my understanding is that's when people who have been in the field working in that area started to say, wait, this is like something we haven't experienced. Now, we've had heroin concerns and other drug concerns back in the late 60s and 70s, then back in the 80s and early 90s. So again, this is both different, but in some ways, it feels familiar to others.
And you know, Dr. Long, you're talking not only about the health crisis and the cost to the economy and the medical system, but boy, what this is doing to families. And we have a question from someone in our audience tonight. This is Angie, and go ahead, ask away.
My question is mostly about the children of the addicts. I would like to know what the state is doing. They're being placed in foster care at an alarming rate, as everyone knows. A lot of family members would like to take those children, but they don't find a lot of support in the system from the state. The state's paying foster care parents an overabundance of money to care for these kids, but the family members cannot receive that same type of support, which makes it hard for those families to stay together. In my opinion, if that support was there, more families would be able to keep those children and stay closer to that family to hopefully at least reunite them at some point once those addicts are clean.
And Angie, do you know about this firsthand?
I do. I've raised 2 children from family members that have been addicts, and starting out, I was very young, taking one of those children in, and it was a financial struggle for us. And trying to get help at that time, it was almost non-existent. Mm-hmm. And 20 years later, I took another child from a family member who was an addict as well. And at that point we were financially better off to help with that child. But the same mother has 4 other children that were placed in foster care because we were not able, and the family were not financially able to take those children in because we were already raising those children from her previously. So my question is there something going to be put into place to help these families financially to be able to keep those children within their actual family instead of foster care?
Maybe we should direct that to Andrea, since she's here tonight representing the state.
Right. So we have a number of different programs before we ever get to the point where the child has been born. So one of the issues we deal with is neonatal abstinence syndrome. The state invested money in the maternal opiate medical supports program called MOMS to try and provide medication-assisted treatment to those parents prior to delivery, which would then decrease the amount of time the child spends in the NICU, but also treats the child and the mother and the family as a whole. That was piloted in 4 different counties. And there were certain things that we recognized as a result, one of those being the very issue that you bring up, which is if we really believe in family reunification, is there a way that we can keep the family together to begin with? And some of that relies on a great deal of advocacy, which are local children's service provider, as well as working with advocacy groups throughout the state. There used to be the model, let's place them with family, but we didn't want to pay them for the kinship care. But if you're able to go to the local commissioners and city council who fund your children's services provider with state funds and say, this is the cost for you to place this child out of the family, and this is the cost for that child to remain in the family, sometimes it's as simple as showing the numbers. Sometimes it's also about making sure that they understand all of the ramifications to the entire family system, not just the parent who you're removing the child from, but the trauma that the child experiences as a result. And the likelihood of that child, if not kept with family system, to also end up in the very same system that got the parent to that point. So again, working with your local alcohol, drug, and mental health board, finding out who the ombudsman is within your community that's connected to the children's services providing agency, and sometimes doing a simple cost analysis and presenting. Often you have courts that are involved. If you have a family drug court, getting involved with the family drug court, working with the judge, working with the prosecutor and the defense, they can sometimes be your strongest advocate as well as the advocate for the parent and the child. It's the way that we've typically done things is this, right? It doesn't work. It doesn't work for the family, it doesn't work for the child, it doesn't work in terms of cost. And so if we really want to have an impact, we have to kind of reevaluate the way that we've been doing things, but also present them with options. And sometimes using your voice is the strongest option.
Thank you so much.
Bill, would you like to weigh in on this? So often we look at teachers in today's society as more than just educators. They spend an awful lot of time with our children.
Well, they do, and we like to think that we're family. We like to think that those teachers that are in the classroom are there for a very specific specific reason, and that reason is because they love kids and they want what's best for those children. And quite often, not just with the possibility of addiction, but anything that goes on in that child's life, those teachers become first responders in a sense. They're the first person to see that instance that makes them go, that child needs a little extra help, that child needs some intervention, that child needs a mentor or an advisor or something along those lines, and begins the process and can begin the process at a very, very early age. We have guidance counselors that speak to 3-year-olds. And so it's something that we're very proud of our preschool, but that also gives us a head start on kind of looking for those reasons to get a child involved with additional services. And that continues all the way up to something very nice that we have called an advisory period in our high school, where our high school staff will be assigned as an advisor to each and every student that comes into our high school, and in most cases will follow that student through all 4 years, and obviously get to know those children, those young adults, so much better than just seeing them once a day in a class. And those children, again, feel that trusting attitude and feeling towards those advisors, and gives them an additional outlet for them to use and speak with.
Yeah, it makes a big difference.
It does.
One of the things that we're learning, that Mike and I have learned in our research, is it's all economic groups, all age groups, all walks of life. And Wally has a question tonight about veterans and opiate addiction.
Yes, we have brave young men and women who enlist in the military. They wasn't addicts when they got there. Some were severely injured. We do remarkable things now in medicine, so more and more is coming back, but they're not coming back complete. And it's something that I know a soldier that came home, and he was highly decorated, and he's our hero. But when the military was over and he was on his own, he had some real issues with painkillers, and he was hurting. And we, as a family, we didn't really have any place to go to say, okay, this is what you can expect. This is what you can do. You can only do what you think is right. There comes a point when your hero kind of runs out of that status, and all of a sudden, sometimes you look at him as just as a addict, and that tears you apart inside. It rips your heart out. And so I'm kind of encouraged that everybody's here tonight, that this is the first step, that you have to recognize there's a problem, but where's everybody going to take this after this? Is this a one-shot deal, or are we going to keep working on this? That's my question.
One of the things you bring up, and I think you've got a ton of different issues there, and that's exactly what this epidemic is. It's coming at us from all directions, and historically what we do is we criminalize the disease, but we've never criminalized cancer, right? This is a disease that requires medical attention, and also requires a bunch of different methodologies of treatment. So when you mentioned veteran services, the last time we had this epidemic was actually out of the Vietnam era. And one of the agencies that started from that period in Watts was called the Vet Service Center, because many of these individuals were coming back addicted. So the Vet Service Center is absolutely a place that you can go, not just for the individual who's addicted, but for the entire family, because again, they understand that this person is just one piece of this issue. The other is, the Vets Administration is acknowledging we do have a problem. And the problem, as you indicate, it may start off as a pain that is physical, that's treated with a medication, but when you start to peel away at that onion at its very core, you're dealing with a pain that's also emotional, that may have happened even prior to that person being enlisted and being exposed to the traumas of war. And so how do we get to that? How do we get to the very quick of it? We have options for medication-assisted treatment. We have options for individual, family, and group counseling. We have avenues even within, if you don't want to go the route through the VA, because I've worked with a lot of people who have military and veteran services who feel like if I go to the VA, I'm saying something about myself, that I'm weak, I should be able to handle this. But again, we would never say that about a person who had cancer or diabetes. So the conversations that we have around this disease, we have to change our dialogue, our definition, and our understanding, and draw the parallel to other diseases. And for the person who is a veteran, who's had military service, you've got to use those resources to the nth degree with the Vet Service Center and the Veterans Administration, and they're to treat the entire family.
And I would just add that what Andrea just said is at the core for providers and for individuals who are at risk or who may have an addiction and their families. We are now learning, we've learned so much in the medical profession, that this is a chronic relapsing brain disease. So we know that now. It impacts the receptors. It has total body impact. So again, we have had to relearn and rethink how we address this. But we know that it both impacts the individual and the entire family. So again, we all, and both in the medical profession and in our communities and in the healthcare system, are relearning how we think about this and how we address it.
Wally, thank you so much for your question,
Just
sir.
a follow-up question, please. I didn't hear anything about longevity. How are we going to, continue? What's going to happen after this? And all due respect, I don't think I've had one cancer patient come on my property and steal anything.
No, you haven't.
And that's a real issue. There is a difference there.
So you bring up a valid point. And, even within this discussion and over the past several years, I get really nervous about saying opioid epidemic. What we're dealing with is a substance use disorder disease. That even long before the opioid epidemic, we had alcoholism. Still, the primary reason that people are going into treatment is alcohol addiction. We still have driving under the influence and crashes that occur as a result of that. Again, a criminal act. The long term is we, again, have to address this from a systemic perspective. From the Vets Administration to the Children's Service Agencies, to the educational system, to the medical field. And we have to invest in the prevention much better. Yes. We know that with prevention, programs like Start Talking, if you start talking to young people from a family, a teacher, whomever has interaction with that young person, we know that that young person is 50% less likely to ever become addicted. But we've also made those conversations taboo for years. And we've tied this disease to morality and saying it's a failure of the character of the human being. And you're also right about, yes, there's criminal charges. You can absolutely, and I think Brandy can probably speak to this better, hold a person accountable for the decisions and choices that they make that are criminal, while also providing them treatment and not dehumanizing them or stigmatizing them in the future.
Alrighty, thanks so much, Andrew. Go ahead, Brandy, very quickly.
If I could just follow up. I was a drug addict for 17 years, and I never walked on someone's yard and stole from them. I did get my drugs the way I needed to, but so I think, when we have stuff like this and we have town halls and the question gets asked, what do we do after this? I know for me, I deal with it every day. Every day I go to work, every time I come home and I talk to my kids. So, and all of us, I know, sit up here, are dealing with it every day. The problem is there's not just one answer to it. Because we're dealing with humans, we're dealing with personalities, we're dealing with character flaws. So we can't sit up in here and say, okay, after tonight, we're gonna get addiction. Because everybody's different. So it's gonna take an individualized treatment plan for each person.
Alrighty, thanks, Brandy. We want to remind our viewers at home that you also have the opportunity to engage and ask questions. You can join our Facebook Live discussion by going to our NBC4 Columbus Facebook page. Ellie Merritt and Mark Taylor are holding a conversation with members of the Ohio Department of Mental Health and Addiction Services. They can also answer your questions or direct you to resources. And as we go to break, a little reminder, we have volunteers from Breaking Point Recovery Center staffing our call for lines at 821-4444 for any questions that you may have. We'll be right back.
The opiate epidemic has reached really every corner of the state of Ohio. Tens of thousands of adults are addicted. But there are also invisible victims of the opioid crisis, of the drug crisis that has a grip on this state. It's the children of those people who are addicts. And I sat down with a grandmother who has found out that her life has changed entirely because at her age, she's suddenly raising an infant.
She was in protective custody. So I filed emergency custody through the courts.
Tammy Zimmerman's phone rang, and it was a wake-up call. Her son and his girlfriend were in jail in Winston-Salem, North Carolina, after a violent fight over drugs.
And that was my rude awakening. You know, that's how I found out there was a big issue. The choice was I would take her or she'll go to foster care. So I didn't give my son and his girlfriend a choice. To me, there was no choice. She's going to stay with family.
A frantic trip to North Carolina, learning little Trinity had been born an addict, had to go through withdrawal. The truth unfolding in medical records.
I needed that because I needed to know what I was dealing with.
So you find out your granddaughter was addicted, then she was given methadone. It had to break your heart.
It makes you sick at your stomach, and you hurt for the baby who has no choice. She has no say in the matter whatsoever.
Tammy says it's too easy for her son and his girlfriend to buy painkillers on the streets from someone known as the pill man, who they refuse to turn in. Too easy for them to let someone else raise their child. Trinity's mother, the girlfriend, also has a 3- and an 8-year-old daughter being raised by their maternal grandfather.
He wasn't expecting to be a new dad at 50-something either. Your entire life changes, but the sacrifices you make are for the children. I'd never put a child in daycare. She was my first one. My own, I stayed home. So I had no idea what the cost of daycare was. Holy cow.
Child care, diapers, toys, baby clothes. Not where Tammy expected to be at this point in her life. But she says Trinity is a joy. She posts pictures on social media for the parents to see.
I want them to see what what they're missing, and I'll tag my son. Sometimes they'll answer. They don't call about her, rarely call about her. That breaks my heart. How can you not call about your baby?
Tammy believes the parents love their baby, but they love drugs more. So Tammy finds herself a grandmother and a new mother, all at the same time.
You're so silly, aren't you? I could not regret doing what my heart tells me is the right thing. What I regret is not being more aware of the drug use. She needs love. She needs to know that she's got somebody that will be there for her, and that's going to be me. Right, Trinity? Say it's going to be Nana.
Dealing recovery and addiction. June, you have a question on that subject, right?
Well, yes. I am a retired health education teacher, 35 years. And in my 35 years, I've looked at the state of Ohio's health curriculum, which I'm seeing you shake your head. To put it politely, it's really lacking. The very first sentence in the document says that the state legislature will not permit there to be any health education standards. I think we are really letting our kids down in the schools by not taking a good look at that. Another thing I learned, and I have some packets here with lots of information if anyone would like to have them. These health education standards expired in April, 12 days ago. There's nothing there to replace it. So I would like to bring up the fact that there are national health education standards, 1995. Just about every state in our country uses them. I have looked, and I've got a couple in my packets from Nebraska. Nebraska had, I believe it was 6 deaths out of 100,000 people to opioids. Their health education standards outweigh Ohio's. I also have Massachusetts. Their health framework was 102 pages. Massachusetts is the highest educationally equipped state 2 years in a row. So I would like to know what we can do, what you can do, what parents in the audience can do to get these health education standards up to date, because we are really doing our kids a disservice by not giving them the skills and the knowledge to help them advocate for their own health and well-being.
And who would like to take that question?
Wow.
Why don't we go to our educator?
You know what?
Then I'll chime in.
That's something, obviously, And you can go through every realm of curriculum that the state manages, and obviously there's something that we could find that would be lacking that we could help with. One of the things that I think most school districts do, at least those who are working towards this epidemic, is they'll add additional material. We add additional material to our curriculum. We have advanced health classes that will address those topics. So it's not necessarily always following the state standards. Sometimes you get dinged when you don't follow state standards when those tests come around, but we feel like that's something that's more worth that venture to attempt to provide more knowledge. And it's like that with anything. The more education that you can provide, obviously the better decisions you're going to make. And that's one of our goals, obviously, is to make our students more educated about the issues that affect us, not just the opioid epidemic, but everything that can affect a teenager. And we'd like to think that that's something that allows us to have a lower rate of usage than many of the Central Ohio school districts do. But your legislatures, the Department of Education, all of those are groups that the voice of a community member, a former educator, and bless you for teaching for 35 years. I'm on my 29th, and I'm looking forward to my 35th year. It's really something that I think the community, the voice of the people, making those kind of issues known will always mean more than a superintendent calling in and say, hey, we need to change this.
You know, along those lines, I would like to turn my attention, if I can, to Heidi. I did a story with her a few years ago. Her daughter died of a heroin overdose. What do you think could have been done differently? Could there have been an education program? Could there have been something that might have changed things for Heidi? Because if I remember correctly, the drug dealers, when she was struggling with recovery, brought the drugs to her bedroom window.
Mm-hmm. Actually, to our house when we were sleeping. And I think it's a whole new world of how you can even get drugs. And it's, you know, disposable cell phones. It's very hard to track that. I think for us living in Pickerington, no one was talking about it in the school system. I was an elected official, but you didn't hear anything about heroin. In 2010, 11, well, then she passed away in 2012. And I remember when we found out, just being so shocked because it was a street drug, junkie drug, not our Marin, you know, who had a wonderful life, a wonderful upbringing. So no one was talking about it, but I think now we've seen there's a lot of the schools are on board, and I do think they're doing more to address it and to be there. And I think for me, that makes me feel better that maybe we won't lose another child because they will get that help.
And Brandy, I see you nodding your head.
She said something that just really resonated with me. We're always playing catch up. And I think we're always going to play catch up. When I was doing drugs back in 2008, heroin specifically, it was nothing like the heroin that is here now. The whole game has changed completely. You know, back when I was doing drugs, you'd done drugs to get high and you kicked it with friends. And now people will shoot you. It's just gotten crazy. And the more we're learning about the stuff that the heroin's cut with, you know, because this is new to us too, so we're all kind of re-looking at stuff. And so we had this idea of what heroin was, and we was probably on the right track or about there, and then boom, we got hit with fentanyl and carfentanil. So I think we're always playing catch up. But I do think that we are trying to do stuff. The community is trying to do more things than back in 2010, back when I was doing drugs.
Right, and you bring up a good point, and the educator does as well. So under the Governor's Cabinet Opiate Action Team, one of the House bills that was passed was House Bill 367, which does require all public schools to provide prevention education specific to opioid addiction. The problem is funding. So you'll hear frequently, you can require us to do something, but if you don't give us money to tag along with it, then where is the programming and the educational piece? Well, there are options. So one of those options, free options, are programs like Start Talking, and they'll come into the school and work with you, or through the Drug Free Action Alliance. They have an entire list of evidence-based programs that are free. Again, through the alcohol, drug, and mental health boards, there are prevention agencies that will partner with schools to come in and provide for those issues when teachers are saying, hey, I've got tests to grade, I've got lesson plans to write, you're expecting me to do X, Y, and Z. Well, this actually also, aside from freeing up the teacher's time to do the things she really needs to do or he needs to do, it allows the prevention education to go to the young people. So it's as you say, it's not one thing, and I think often we try and say, well, this needs to change, and there's a lot that needs to change. But it all starts with having conversations about what the facts are, what the realities are, and what the options are in terms of how to address it.
Well, we are going to go back to the station right now because we have some experts there, too, taking questions on our Facebook page and on our Call 4 lines. Ellie Merritt and Mark Taylor are with them right now.
Yeah, we've got the experts around the table here to answer your questions, all kinds of questions. And you can call right now. The number is 614-821-4444.
Yeah, joining us live tonight, we have Tom Daly from the Breaking Point Recovery Center here in Columbus. So you guys have been taking calls all night. How's it going?
So very well. The phones haven't stopped ringing since you turned them on, of course.
Yeah.
Okay. Any? Yeah, well, that's good. That's what we want to hear. And if you have a question, feel free to give us a call. Any takeaways? What kind of questions are you getting so far?
I'd say it's two groups. We have folks that are seeking treatment for themselves or for a loved one. We also have a lot of folks calling for family support. One of the stories was grandparents calling about their 8-year-old grandson who lost both parents to overdoses and looking for support for him. So a lot of that type of stuff.
Yeah, you're hearing some pretty powerful stories. What are some of those warning signs that if a parent is watching right now and wonders, does my child have a problem, or does my child's friend, are they with the wrong crowd or something? What are some of those early warning signs?
So any police involvement, things that start missing from the home, especially if medication turns up missing, repeated dishonesty, if you catch them in lie after lie about where they've been. Those are the kinds of things that you look for early on in early teenage, 14, 15-year-old kids to see. If you start to see that stuff, you may have the beginnings of a problem.
And then if you do unfortunately recognize some of those signs, you try to talk to your child, have a frank conversation, and then it doesn't work out. What are the next steps? What should a parent do who wants to make a statement, to their child?
Well, I'm not even a parent, and I can't tell you how to parent, but certainly when it gets to the point where, if it's become too much, we've always recommended sort of the old tough love approach, right? So if they're still high school age, you obviously prevent them from going anywhere as much as you can. If they're above that age, if they're over 18, it's time to put them out of the house and tell them, until you get help and face this problem, you're no longer welcome under my roof. And that's not an easy decision to make, or is it easy for us to tell someone to do that?
Tom, I think sometimes that first call is the hardest one to make. Of all your volunteers here, what kinds of questions are they taking, and can they take tonight?
Yeah, so anything you can think of, right? If you know someone who needs help, if you want to know any type of service that you're not sure which place to call, we have a full list of every resource available here in Franklin County and outside of Franklin County if needed. So anything under that umbrella, addiction, substance use disorder services, or support thereof, right? Family support. We're trying to help them all, and hopefully we'll do so.
All right, Tom, thanks. You can always call in if you have a question, and we also have a Facebook conversation going as well.
Yeah, you can join our Facebook Live discussion going on right now on our NBC4 Columbus Facebook page. Members of the Ohio Department of Mental Health and Addiction Services are live now to continue the conversation. We'll be back in just a minute.
The road to recovery from drug addiction, it can be a very, very bumpy trail, but it is possible. Brandy Morse-Hafner is a really good example of how determination, hope, and hard work can lead back to a successful recovery. Brandy had to sink pretty low in her life before she was able to find the right direction in her life. Brandy Morris-Hafner tells her story through a series of mugshots she's collected through her world of addiction, which led to 8 years of incarcerations. Her changing appearance shows the control drugs had on her life. Brandy is not proud of this photo display, but uses it to describe the dark places of addiction.
I couldn't even stop at a stop sign without thinking about doing heroin. You know, if I would be at a stop sign, I would choose to go right. Well, if I go right, then I can stop up here and probably do a bump real quick. But if I go left, I can go to so-and-so's house. Like every thought when you're on heroin, it has to do with that drug. Everything.
Before heroin took a grip of Brandy's life, she says she sampled a lot of drugs. In fact, it turned into a balance of drugs just to feed the high.
A lot of heroin addicts will do an upper as well, because when you get too high on heroin, you need something to bring you up. So you'll do cocaine or crack, and then it takes the opioid out of your system, so then you need more heroin. It's just this cycle that you just, oh my gosh, sick.
After selling and using drugs for 17 years, the change started. While clean and sober, Brandy earned 2 college degrees, graduated summa cum laude, entered a new and healthy marriage, regained custody of her daughters, and standing in front of Ross County Sheriff George Lavender, but this time to be sworn in as the director of the County Day Reporting Program. Not an easy road, but an example of what can be obtained with sobriety, work, and hope.
Almost everybody that I hung out with is either dead or locked up, or they're still using. And it's very, I know what that life's like, and I know how dark it is, and I know how people feel like there's no end to it. And I want people to know that there is an end to it. And not just an end to it, but you can turn your whole life around and be absolutely successful. Absolutely successful.
Hope, really, thank you so much for sharing that story. We have a question for the panel tonight from Derek. Derek, what would you like to know?
Like she said, I'm Derek. I'm from right here in the neighborhood. I'm here with a group tonight, a church, Grace Ministries, right down the street off Rathmill. And we just recently started a recovery program trying to help any way we can in this situation. But this is kind of a group question, and we wanted to know what our city was doing to stop the epidemic other than Suboxone, Subutex, and all the other drugs they're using to try to help in that area.
So I really appreciate the question, and obviously it's going to take everyone. So actually I was just chatting with your superintendent about the churches and how they have gathered together. So that's terrific. We do think it's going to take all of us. We clearly take our role in public health, and actually I'm joined by my colleague who's the Franklin County Public Health Commissioner, Joe Mazzola. So what is the city, what is the county doing? Again, we're working in big partnerships. Our job in public health is both to raise awareness, to educate. We are working with many partners in doing that, and actually already we've just talked about one of the key things is around shame and stigma. So good for you that you are overcoming that and being willing to talk about this, because that actually does drive people to places where they can't get help. So we also spend a lot of time talking about help. So one thing in public health we really are trying to make people aware of is naloxone. Again, it's the opportunity to save a life. So indeed, we are encouraging everyone to consider getting naloxone, to carry it with them like I carry it, because you never know when your opportunity will be then to save a life, to help them be a bridge to recovery, to get that treatment. We clearly are advocating for treatment as well. We also have started a harm reduction program, which actually is all about, again, a bridge to recovery. So we are offering clean syringes to persons who are actively using drugs, intravenous or injection drugs because we know we also have other epidemics connected to HIV, hepatitis C, hepatitis B. So again, clean injection is very important, along with giving people access to treatment services and again, naloxone. So again, those are some of the things. We've set up an emergency surge response system. So indeed, the mention of some of the new synthetic drugs that are not just creeping into, but are very present now and cut with some of our heroin. Our carfentanil and our fentanyl is actually greatly increasing the need for active response by EMS. Actually, some of our police and law enforcement agencies, our sheriff department, our Columbus police are now offering also, are using naloxone. But our surge response system is now pulling together within 2 hours of when we think there may be an uptick in actually drug overdoses that our EMS or our emergency departments are seeing. We have 10 agencies on the phone trying to figure out what's going on and how can we better protect the public. So there's a lot going on. And then again, I think many of us feel that underneath all of it, we need to create more treatment options, a whole spectrum of treatment options. And again, more around education and prevention. So it's going to take all of us. We can do it. And again, we have many partners already, but again, love to hear about the church, love that the schools are involved, because again, this will take all of our community really digging in.
And we're tight on time, but we're going to try to get another question. I'm sorry, we're going to try to get another question very quickly.
Full disclosure, I do know Andrea and Heidi both. Heidi and I's stories are extremely, extremely similar. We both lost our beautiful girls in 2012. I created an organization afterwards, and one of the main things we do, to the teacher's point, is educate communities about addiction. We go into our local schools up in northeastern Ohio every semester and do the health class, and I give a presentation called Addiction 101, which kind of simplifies and gives people a basic understanding of everything that's going on. But I do a lot of advocacy at the government level, state and federal. That's why I'm down here now. I was at the Rife building all day, up and down, up and down, and up and down, and I will be for the next 2 days. And one of the things that I'm pointing out to them, and Andrea, to put you on the spot, it is time for that budget, and everybody's looking at funding. One of the things that I wanted to ask is Governor Kasich aware and considering the fact that every 25 minutes a baby is born addicted to opiates? And that's a stat that we all say, about. But really think about that. Every 25 minutes today, a baby was born addicted to opiates. In 5 years and 10 years, those babies are going to be in elementary school. And our teachers are going to be dealing with the physical effects, the mental effects, the behavioral. You know, it's a nightmare that we have coming that we need to start preparing for now. And I just want to know that's on the radar.
It's more than on the radar. It's a constant conversation, and the governor has been pushing. As you know, Ohio is a Medicaid expansion state. We've enrolled 700,000 people into health care that otherwise would not receive it. Many of those who suffer from substance use disorder, many of those who are giving birth to children who have neonatal abstinence syndrome. So one of the big pushes from the governor's office is we need to make sure that it stays. Because my fear is if it's repealed, if it's rolled back, 700 individuals will not have health care, including for treatment, not only of substance use disorder, but all other health conditions, including those that may be comorbid to that of HIV, hepatitis C, what have you. So yeah, we're definitely, the governor's well aware. And also the investments that we're making with regard to drug courts, the expansion of medication-assisted treatment, those are investments that will come out of this budget, as well as the provision of naloxone to first responders. The governor provided $500,000 annually to go to local health departments to be provided to first responders primarily being law enforcement, as this was not a piece of equipment they were used to carrying, and yet often in rural communities this could be considered one. The sheriff's department might be the first responder before the EMT ever gets there. Now, the EMT, under your fire and safety budget, under city council and commissioners, naloxone, Narcan should be included as part of their unit and their equipment. They also frequently have the ability to bill for the services. When an EMT comes to the home, if you've had an injury, someone will be billed for that. And often it's insurance or it goes to the commissioners and their budget. But the governor is definitely on top of this and strongly advocating for smart investment, proper investment, and looking at things at what you're talking about. Not just the short term, but what is the long-term effect, and how do we target our dollars to make sense then as well?
We're going to take a quick break, but I'd like for the panelists to think about this question going into the break. I received a phone call from a gentleman today who said, why are you doing this? Why are we committing money, state money, local money, federal money, to these people who voluntarily put poison in their body? Think about that question. We'll be back with our town hall confronting the drug issue when we come back.
It's going to be fun.
Let me see. So Mike asked the tough questions right as we go into break, and we're going to get some quick answers, I guess.
We'll start with you, Bill.
Well, it truly takes a village to support a child, and an example of what we're doing today isn't a waste of money. It's what's best for our youngest our youngest group, and if we can start at that level, start helping and use the large group that we have encompassed here, as well as all the community members that are with us tonight, it's going to be a much easier problem to solve. Never be easy, but it'll be a much more solvable issue if we have from education to the governor's office to the federal level, all working together to solve or help with this issue.
Dr. Long?
So, as health commissioner, my job is to protect health and save and improve lives. I take that responsibility, as I think all physicians and actually all of us in public health would be. So why do we care about this issue so much? It's about saving lives and allowing people that bridge to recovery and a full and productive life.
And I would say there's two sides to it. One is you can either pay for the treatment or pay for the incarceration. And what we know statistically and through research is you will pay a great deal more for incarceration. Secondly, we have no issue when we have elected officials for whom we pay their health care. If you have high blood pressure and you go to eat a steak or you don't work out, no one's saying, hey, let's stop paying for their health care. But we want to do that for a similar disease, which is a chronic progressive disease that can ultimately lead to death. So I think that we need to kind of, again, it's changing perspective and changing the framework and sending the message clearly.
And Heidi?
It's a disease. It's not about the character of the person, it's the chemistry of their brain. I know my daughter didn't choose to be a heroin addict. No one does until the disease happens to them. And like Andrea said, we pay for any other heart disease, diabetes. Insurance companies need to step up. I hope someone politically does that and get them to pay for the treatment.
Randy, final word.
So this really strikes a chord with me because
of course it does.
I wouldn't be here. I wouldn't be sitting right here if we didn't pay for this stuff. When I first started doing drugs, and this is any drug, I chose to do it. You're right, I did. But I had no idea. I thought I was just doing drugs. I thought I was just having fun or, just trying to get rid of the emotions I was feeling. I had no idea I was going to become hopelessly and helplessly addicted. I had no idea. And if we don't start looking at this for what it is, and this isn't just our opinions up here, this is a proven fact that it is a disease. So, we deal with obesity every day, but we don't get mad at someone for having a piece of cake. If we don't do this stuff, that little girl down there would have been without a mom.
Randy.
Well, we're glad that she is here, and we're glad that you're here. Brady, thanks so much.
And we are so glad that you tuned in tonight. We hope you learned a few things, had your questions answered, listened to some powerful stories. We thank you so much for being with us.
As always, there is reference material at NBC4i.com. Have a great evening.
Thank you all.
Thank you so much.
Tonight's NBC4 Town Hall is sponsored by Breaking Point Recovery Center.